MRA diagnosis is an active disease or condition that can be acute or chronic, and that determines a patient's level of risk, which helps CMS projects the cost of caring for that patient for next year. Each risk adjustment diagnosis belongs to a specific category called Hierarchical Condition Category or HCC. And each HCC has its own score, the Risk Adjustment Factor Score or RAF score. All diagnoses that have a similar risk for resource utilization for patient care belong to the same HCC, which is assigned a value or score associated with that risk. For example, congestive heart failure and cardiomyopathy belong to the same HCC. Calcification of aorta and peripheral vascular disease belong to the same HCC. Chronic obstructive pulmonary disease and emphysema of the lung belong to the same HCC, meaning they are assigned the same RAF score. Each HCC has its value, its risk adjustment factor score applied to adjust payment for resources projected for patients' medical care. The higher the score, the sicker the patient. That means the patient care management will be more expensive, therefore, reimbursement will be more significant. For example, the RAF score of diabetes with acute complication is higher than the score of diabetes with chronic complication, which is higher than the score with diabetes without complication. It is very important to document a diagnosis with its greatest level of complication. Remember, Medicare risk adjustment payments are prospective in nature, which means that diagnoses from claims filed the previous year are used to calculate the patient's risk score for the current year. Therefore, if you want your reimbursement to be great for next year, you must start using good documentation in your patient's medical records right now. RAF is the total score of all risk factors for one patient for a total year. Risk factors are additive, meaning the risk scores for each chronic disease are tallied to determine the patient's raw RAF score. Demographics contributing to an RAF include the patient's financial status, whether the patient lives independently or in an institution, the patient's age, and sex. Other contributing factors are the patient's Social Security disability status and Medicaid status, and whether the patient's disease is acute or chronic. RAF undergoes a final computation before payment is made, involving the patient's state and county to determine individual capitation rates. CMS uses this rate to determine the final payment for patient care. A calculation based on a patient's total number of HCC is also factored into the final RAF score. If the patient has 4 or more HCCs, an additional HCC is generated due to the payment condition count model. Payment condition count makes an additional risk factor because multiple comorbidities have a synergistic effect on a patient's health. In addition, CMS has calculated that some diagnoses, when occurring together, have more resource intensity than the sum of the two diagnoses would suggest. It will be considered a synergistic risk when a patient has diabetes and heart failure. Therefore, this combination is reimbursed at a higher rate than the sum of two HCCs separately. HCCs and their values are updated annually, and the codes that map to them are updated twice annually.